Before beginning your assessment, be sure to consider these items. It is important to take all measurements on the right side of the body. Mark each site before measuring, take a minimum of 2 measurements per site, and use the mean of the 2 measurements for calculation. Retest the site if they are not within 1 to 2 millimeters of each other and rotate between sites. The 7 Skinfold sites are the triceps, subscapular, mid-axillary, chest, pectoral, abdominal, suprailiac, and thigh. All measurements are to be taken on the right side of the body. First is the tricep. It is a vertical fold on the posterior midline of the upper arm, halfway between the acromion and the olecranon process, with the arm held freely to the side of the body. Next is the subscapular, which is a diagonal fold with the arm at a 45-degree angle. It is 1 to 2 centimeters below the inferior angle of the scapula. Next is the chest or pectoral. It is a diagonal fold with 1/2 distance between the anterior axillary line and the nipple for men, or 1/3 of the distance for women. Next is the mid-axillary. It is a vertical fold on the mid-axillary line at the level of the xiphoid process of the sternum. Next is the abdominal. It is a vertical fold 2 centimeters to the right of the umbilicus. Next is the suprailiac. It is a diagonal fold in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately superior to the iliac crest. Next is the thigh. It is a vertical fold on the anterior midline of the thigh, midway between the proximal border of the patella and the inguinal crest. To take a skinfold measurement firmly, grasp the site, the thumb and index finger, 1 centimeter above or below the site. Pull up and away from the body. Measure the halfway point between the crest and the base and take a reading within 1 to 2 seconds. First is the triceps, a vertical fold. Next is the subscapular, a diagonal fold. Next is the chest or pectoral, a diagonal fold. Next is the mid-axillary, a vertical fold. Next is the abdominal, a vertical fold. Next is the suprailiac, a diagonal fold. Last is the thigh, a vertical fold. To calculate percent body fat, we will be using these equations.